We're going to wrap up cardiovascular system. Just wanted to let you know this video is going to be super quick because I'm giving you quite a few readings to do. Sorry if you hear Sawyer in the background. And some links for you to explore. And you're simply just going to be answering the questions on its learning. I don't really have a whole lot of research components in your assignment just because that's what you're going to be doing to get the information. So I don't have a note sheet this week because I'm giving you different readings that already have the information in it, and then you'll be able to answer the questions from there. However, I will go over some basic info that I think is going to help you before you dive into the readings, just so you kind of know what to expect. So first off, since we talked about the anatomy last time, I want to also discuss the physiology of cardiovascular this week. And so that is going to come down to conduction. The cardiac cells are very unique, or I should say cardiac muscle is unique because it does not require a nerve impulse. It actually has its own node that generates this electrical impulse. And so the sinus node is going to initiate depolarization. It's going to travel to the AV node, atrioventricular node. That depolarization is going to continue through the bundle of His, and as those depolarizations are spreading, it is instructing which cells need to contract, and that way, when the sinus node is depolarizing, it's going to trigger the atrias to contract and squeeze blood into the ventricles. Once that AV node and bundle of His receive the depolarization, the ventricles will contract to discharge the blood to the body. What I would like for you to do in regards to conduction is, let me find this document here. You're going to read this cardiac conduction PDF here. This is what we would have done in class. The conduction can actually, because it's electrical, it can be picked up on an electrocardiogram. EKG, ECG, just depends on your preference. EKG is technically German. Cardio is spelled with a K, and that's kind of where that came from. But anyhow, we can track the different polarization phases or depolarization stages that are happening through the nodes into this diagram that is the ECG. And so we have these different waves. So for example, when the atria are depolarizing, we are going to get this P wave right here. So this is the atria is contracting. From there, we are spreading down to the AV node, and when we have ventricular depolarization, remember the ventricles are discharging. They are going to need a lot more pressure than the atria needed, because the atria are just going next door. The ventricles are discharging out of the heart, and so we're going to have a lot more strength going into this depolarization here. That's where we have this QRS complex. We're going to have our depolarize, repolarize phase, and then from there we need to get back to depolarization. Then we need to repolarize so we can get back to atrial depolarization. So this just happens over and over and over again. You can see here we have P wave, QRS complex, T wave, P wave, QRS complex, T wave, and it goes over and over and over again. That being said, and I'm kind of bummed that we don't get to do this in class, I have a couple questions that I left here for you. Sorry about Sawyer. This is a link that I provided on It's Learning to Practical Clinical Skills. And what you're going to do is go to this website and answer the questions regarding how to read an ECG or EKG so that you know what the different complex and segments and intervals represent. And then the other thing that I like about this website, and I'll bring it up to show you, maybe, no, not here, hang on. Here we go. There are practice drills that you can do. You can go over the basics. And then there's also very common abnormalities. These abnormalities are things that if you're going into the medical field, especially if you're in a cardiac unit, you are going to get to know these because you can diagnose various scenarios based on ECG readings. I even had my own done when I was pregnant. I was having premature ventricular contractions. And so what happened was my ventricles would contract and discharge the blood, but then they would contract too soon. So then they would have to wait longer to fill again. And so it was kind of like my heart would do a double beat and then skip, and double beat and skip. And they were able to diagnose that through an ECG. Oh, here we go. Premature ventricular complex right here. So that's exactly what mine looked like. Okay, so that's what I want you to do for conduction. Following conduction, we're going to dive into blood info. That kind of sounded gross. This is again what I just talked about. Blood components. Blood is technically a tissue. It's a liquid tissue. Tissue simply means it's composed of more than one type of cell. So you have your RBCs, your red blood cells are also known as erythrocytes. You have your platelets, you have your white blood cells, which are leukocytes, and then plasma, which is going to be the aqueous portion. From there, I then have another reading for you about blood count. Again, this is something we would have done in class, so it's quite unfortunate that we're not doing this. But you're going to read the background on the function of each component. So platelets, RBCs, leukocytes. There's different types of leukocytes or white blood cells. Leuko meaning white, cyte meaning cell. And then blood cell count. And this is just talking about the different values that are normal for white blood cells, red blood cells, and platelets. From there, this is optional, but I do think it's interesting. We would have done this in class. You have an opportunity to complete a blood cell count and diagnose your patient based on the information here. So you can go through, you can count the white blood cells, red blood cells, platelets. You can observe any misshapen cells. I don't know if misshapen's a word, but I said it. And figure out what condition this individual has. From there, your last bit is going to be about blood typing. So your blood type is based on the surface proteins on your red blood cells. These surface molecules are referred to as antigens. And in the plasma, you have antibodies that float around. Whatever blood type you have the opposite type of antibodies that are ready to attack off the non-compatible blood if it were to be introduced to your body. So if you have blood type A, that means you have antigen A. Blood type B has antigen B. Type AB has both of them. Type O has neither of them. However, they all have the opposite antibodies. So type A has B antibodies, type B has A antibodies, etc., etc. When these antibodies come into contact with the antigen, they hold on and they cause clotting. And that means that blood typing for transfusions is very important. Here is a quick little example, or I guess diagram here. In order to test blood, what you do is you put the blood, or a drop, just a drop, into a serum that contains the antibody that fights against it. Okay, so for example, A blood has antigen surface proteins. If you put it in antibody A solution, it will cause it to clot up. Same thing, you have anti-D, which is your positive negative. If you clot, you are positive. If you do not clot, you are negative. And so you drip the blood into all of these. You have a control to make sure that there's nothing wrong with, there's no abnormalities going on, because if the blood clots, even though there's no antibodies, then something's wrong. But anyhow, drip in anti-A, drip in anti-B, drip in anti-D, and then you figure out whichever one clots is what they have. So for example, A positive for D, or B positive for D, right? A, B positive, right? Because they all clotted. And then here is an example where if the control is clotting, then it needs to be redone. Okay. When it comes to this, you have one last reading. It's pretty quick. You can skip over the first part. It's just like a little review of Punnett squares. But from there, it talks about blood types, antigens, which are the surface proteins, and antibodies, inheritance of blood type, and blood transfusion. When it comes to blood transfusions, it's important to know your patient's blood type, because if you give, say, type B blood to a person with type A, you're giving them the wrong antibodies and it's going to make their blood clot. You're giving them the wrong blood cells and it's going to make their blood clot, because type A people naturally have these plasma antibodies. They can filter out the antibodies from the donor blood, but you can't get rid of a person's natural antibodies, right? So if you put B blood into an A person's system, their B antibodies are going to attack. And when they attack, that's going to cause clotting. It can lead to organ failure. It can lead to stroke. It can lead to death. All kinds of bad stuff. And from there, sorry guys, I know this is a lot. This is why I tried to limit notes and you just have readings instead. This is optional, but this is called the blood typing game. I actually do this with my bio classes because I just think it's so interesting. We do it in genetics just to talk about dominant versus recessive. But for your sake, if you were to do the blood typing game, what it lets you do is you will take a sample from your patient, you drop it into anti-A, anti-B, and anti-D serums. you check for clotting, and then you figure out their blood type. From there, there's a couple of instances where the individual will need a transfusion. So once you have their blood type, you can then figure out what type of transfusions you can give them. Now keep in mind, we don't always know somebody's blood type, so you need to figure out what you can use in that instance. The other scenario is, say you have B positive blood, but maybe the blood bank doesn't have B positive blood. So you'll have to figure out what other types of blood can be given to that individual and not cause a bad reaction. So I really like that one. Okay. As far as your assignment, I just want you to complete the readings, answer the questions, and explore the Nobel Prize typing game. It does require Adobe Flash, so if you don't have that, it's not too big a deal. There are videos about it that you can always look at. But that's about it. I think so, yeah. So conduction, blood components, and blood typing, right? And that will wrap up Module 5.